Basic instrument passing is very much a part of four-handed dentistry. So four-handed dentistry occurs when the dentist's two hands and the assistant's two hands are working together as a team, working on the patient. First of all, notice that my assistant is actually sitting about 5 inches taller than me, which is correct. The two-handed pass usually comes first, and then we can begin to pass an instrument for another. The assistant is going to hold out a pinky, take it, and place it in my hand. And she's going to actually make sure that I actually have it and I'm not going to drop it or mislead it anyway. Or she might decide to put out two fingers, the end two fingers, and do a two-handed take with the instrument. Notice when any instruments are being passed, they're being passed here in the transfer zone, which is over the left shoulder of the patient and under their chin. And instruments are never passed over the patient's face. And notice that our patient, for their own safety, is wearing safety glasses as well. Instruments are also passed in the proper orientation so that they face the arch in which the dentist is working. So if the dentist is working on the maxillary arch, the working end of the instrument is facing the maxillary arch. So of course the dentist, you have to follow whatever instructions they want you to do as far as instrument passing. It can vary a little bit, but this is actually the basics of instrument passing and the proper orientation. The assistant continues to put the instruments back on the tray in the working order in which they were being used, with the most common instruments closest to her from left to right. And then when the dentist is done with the instruments, they hand them back, and the assistant again places the instruments in the proper order on the tray. So this is a summary of the basic instrument passing.